Home Assessment Pathway, or HAP as it's known, represents a new integrated approach to assessing people safely in their own homes rather than in hospital, and it's been funded by the Scottish Government. Traditional criteria and hospital-based assessments can delay support and may not fully reflect how a person manages day-to-day in their own environment. By assessing individuals at home, we gain a clearer, more holistic understanding of their needs, strengths and natural supports. HAP brings together existing services such as Discharge to assess, START, Community Response Team, Pharmacy, Community Nursing, Technology and volunteers. It is a single, flexible, multidisciplinary model designed to prevent unnecessary admissions and support timely discharge across all of our primary and secondary care. The pathway supports a cultural shift towards risk enablement, reduces duplication, improves flow, and aligns with key strategic frameworks, including Home First and Discharge Without Delay. Ultimately, HAP reinforces our shared belief that home is often the best and safest place for people, and that assessing individuals where they live helps us design the most realistic and person-centred plan for their independence.
Discharge to Assess, D2A, is a therapy-led service designed to support early, safe discharge from hospital and begin rehabilitation at home as soon as a person is medically stable. The core principles of D2A remain centred on promoting independence at home, starting rehabilitation early, minimising unnecessary time in hospital, assessing long-term needs in a person's own environment and offering time-limited intervention, typically 2 to 6 weeks. After this period, individuals are referred to the right service for any long-term support required. D2A is working in collaboration with the Short-Term Assessment and Reablement Team, START. This partnership has increased joint capacity to keep people at home instead of hospital wherever safe, and to assess needs in the most realistic setting, their own home. Through this combined approach, it has become clear that people with higher acuity needs can still be supported effectively at home, provided they receive timely, strengths-based rehabilitation and the right level of input. START's role alongside D2A has been crucial in delivering hands-on, short-term reablement support, helping individuals regain confidence and function in daily living. Together, the two services have demonstrated that earlier discharge does not compromise safety or quality, rather it enhances independence and recovery. Referrals are no longer limited to therapists. Any trusted professional may refer following multidisciplinary discussion. A centralised referral form will coordinate a wider range of professionals, ensuring individuals receive the right mix of support to maintain independence at home. This enhanced D2A model means it will also extend to supporting individuals in community-based virtual beds, offering the same Home First, independence-focused approach for those at risk of hospital admission.
In general practice, our MDTs will often be the first to notice when someone is beginning to struggle at home. With the home assessment pathway, we will be able to support at this time, whether the concern comes from the practice team, community nursing, social work, therapy teams, or even a hospital touchpoint. HAP will bring the right people together quickly so assessments can happen in the person's home, and we will get a clearer idea of what people actually need to stay safe and independent, which will help us prevent admissions, support earlier intervention, and make sure families are included in decisions. It will fit naturally into how we already work in primary care, ensuring early conversations, shared planning, and focusing on what matters most to the person. Together, HAP and our MDTs will help more people stay well and stay at home.
In Scotland, on average, there are over 900 medicine-related hospital stays per month. Ensuring people take the correct medication at the correct time and that it is right for them is fundamental to support people to remain at home wherever and whenever possible. As part of the home assessment pathway, a pharmacist will be available to carry out reviews of people's medications to ensure that they are only taking what they need to take, that the dosing and timing is safe, and that the risk of side effects or adverse drug reactions is minimised. By reducing a person's tablet burden, we can reduce the risk of potential side effects, such as falls, which can help prevent hospital admissions and improve a person's quality of life at home. Through new innovations and using digital support, we can support a person to manage their medication safely in their own home.
As part of HAP, if required, our new integrated frailty district nurse may visit the person at home to complete a full holistic assessment, looking at symptoms, well-being, daily function, and identifying risks to staying safely at home. Using structured frailty tools, the nurse can spot early signs of deterioration and put proactive anticipatory care in place. Working closely with the MDT, the nurse shares clinical insights to support shared decision-making and helps create personalised care plans based on what matters most to the person. This joined-up approach smooths transitions between primary and secondary care, facilitates early intervention, and helps avoid unnecessary hospital attendance.
HAP reflects the principles of GIRFE, getting it right for everyone. The pathway works to ensure that the person remains at the centre of all discussions, decisions and actions. The pathway is about working together with the person to enable them to remain at home or to get home from hospital safely. In HAP, the social worker is part of the multidisciplinary group of professionals working collaboratively to support the person to get home or keep the person at home if they don't need to be in hospital. The social worker will link with the other professionals in HAP on a daily basis and may visit the person at home to prevent hospital admission. During this visit, the social worker may discuss any supports the person may need to remain at home, or they may visit you in the hospital to plan the journey home. We are moving away from assessing the person in hospital by meeting the person in their own home to talk about their situation. The information the person provides to the social worker will determine whether a further assessment is required. This assessment will document the goals and any support the person requires to reach them. The social worker will share this information with the other professionals that are offering support and will continue to work closely with HAP colleagues to optimise the person's journey to recovery, and will also look at ways to keep the person well and to prevent hospital admission in the future. Our aim is to ensure the person's health, welfare and safety at times of need. Additionally, we are supported by a dedicated mental health officer who will support alternatives to admission and take a strength-based approach to promoting independence with least restrictive interventions. The MHO can advise and contribute to discussions around positive risk management. They can identify the potential need for formal powers under adults with incapacity or mental health legislation, and will take a rights-based approach with individuals and their families.
Technology-enabled support, or TESS, helps people live safely and independently at home. It moves us beyond traditional reactive telecare and into proactive, preventative support. Using discrete, non-intrusive devices with no cameras, TESS gathers only the movement, activity and environmental data needed to understand what's normal for each person. By spotting early changes or emerging risks, TESS helps us intervene at the right time, preventing small issues from becoming crises or hospital admissions. This is especially important for people living with frailty, cognitive impairment, or complex long-term conditions. TESS also provides reassurance. With consent, families, carers and professionals can view real-time information showing that someone is active and following their usual routine. If something isn't right, agreed alerts are sent to the right person or service. Devices can monitor mobility, medication adherence, eating and drinking activity, and home conditions like temperature or humidity. They can also trigger immediate alerts for events such as a fall or a smoke alarm activation. Technology can support day-to-day routines too, through helpful prompts and reminders that reduce falls, missed medication, and other common risks. When combined with the occupational therapy assessment in HAP, TESS creates a safer, more personalised home environment. For carers and families, TESS offers peace of mind. It supports their role without increasing pressure or requiring constant supervision. And for our wider multidisciplinary teams, Tess provides valuable insights between visits, helping district nursing, frailty teams, START and community services identify changes earlier, adjust plans quickly and deliver the least intrusive, most effective support. Ultimately, Tess is a key part of Home First. It helps us prevent deterioration, promote independence and keep people living well at home for longer, supported not just by people, but by smart, safe systems working around the clock.
Re-engage is part of the Home Assessment Pathway HAP, led by the volunteer teams that work across Moray communities, providing a range of services that support early intervention, prevention and self-management as part of the Health and Social Care Partnership. Coming home from hospital can feel like a big step, especially if you're returning to an empty house. For many people, those first few moments bring worry, uncertainty, even fear, and sometimes that feeling alone can make leaving hospital harder. At Re-engage, our aim is to help people feel confident about returning home, supported in those first few days and weeks, and reassured that home truly is the best place for their recovery. Re-engage HAP is for people in Moray who live alone or don't have family or informal support networks and who do not receive formal social care. Our health and social care volunteers can offer short-term, low-level, practical support that helps people feel confident and supported as they get back on their feet. Our volunteers are not there to replace paid care or clinical staff. They simply add a friendly, helpful presence where it matters most. After a referral from a healthcare professional, we arrange a home visit. We have a friendly chat about what would help, and together we create a small support plan to provide reassurance. A trained volunteer is then introduced to offer low-level, practical support for a few hours per week. This might include collecting a simple shopping list, supporting someone to attend appointments, helping them get back into familiar routines, reconnecting them with groups or activities they used to enjoy, or signposting them to something new, or simply sharing a warm conversation over a cup of tea. Everything we offer is focused on building independence, restoring confidence and what matters most to the person. All our volunteers are PVG checked, trained in adult support and protection, and receive ongoing support from our team. They work within clear boundaries to keep everyone safe. They don't provide personal care, medical tasks or domestic cleaning, just the small meaningful things that can help someone feel settled and at home again. Our aim is to ensure that the support we offer has a lasting impact. When our involvement ends, we hope the person feels more confident in their own abilities, feels comfortable getting out and about again, and is able to live a happier, healthier life at home for longer.
HAP is designed to ensure all assessments for ongoing support happen in a person's home and not in hospital during a crisis. This educational video is designed to assure you of the wraparound community support that a person will receive out of the hospital, allowing you to promote early discharge safely. Contact D2A via the MDT or practitioner-to-practitioner referral through the normal channels.